Hello, I am Dr. Dibyendu Rai. I practice at Khorsbagan, Bardhaman. Today, our point of discussion is on ocular allergy. Allergic conjunctivitis are of four types: acute seasonal allergic conjunctivitis, acute perennial allergic conjunctivitis, vernal keratoconjunctivitis, atopic allergic conjunctivitis. To know the symptoms of allergic conjunctivitis, we have to know the pathophysiology of allergic conjunctivitis. Whenever we go to the exposure of any ocular allergens like mold, weeds, dust, pollen, etc., these allergens comes in contact with antigen presenting cells present in conjunctiva, epithelial and subepithelial cells of our eyes. Then, after getting in contact with these ocular allergens, these antigen presenting cells stimulates CD4 plus T cells. After stimulation of these CD4 plus T cells, this converts into T helper cell type 2. These T helper cells type 2 helps in production of IgE. These IgE gets in contact with mast cell present in our conjunctiva. After getting attached to these mast cells degranulates and liberates histamine. This histamine causes vasodilation of conjunctival vessels. These vasodilatations is the cause of redness of conjunctiva. Histamine also causes increase in permeability of endothelial cells. This causes leakage of fluid in conjunctiva, and this is the cause of chemosis and lid swelling in allergic conjunctivitis. The symptoms with which patients used to come to our clinic are foreign body sensation, itching, lacrimation, heaviness in eyes. In late cases comes with refractive errors, and in very late cases comes with corneal vascularization and even with seed ulcers. To prevent these allergic conjunctivitis, we need to avoid the ocular allergens. For this, we have to wear glasses whenever we go outside. We have to wash our eyes after we go to the exposure of allergens. We can use tear substitutes which will make a barrier and which will help in removing away the ocular allergens. In mild cases, we can use decongestant eye drop which will help in vasoconstriction. The vasoconstriction will reduce the redness. In mild cases, we can also use anti-allergic drops like olopatadine, epinephrine, which are H1 antagonist. In mild to severe cases, we can use alkaptadine, which is H1, H2, and H4 blocker, which blocks H1, H2, and H4 receptor. So it helps to reduce the type 1 reaction very well. Alkaptadine molecule like capta helps and works really well in type 1 ocular allergy. It reduces the redness and reduce the itching too, and in a better way than olopatadine and epinephrine and bipotestin. In severe cases, we can use topical steroid eye drops for shorter duration in a tapering way. And in very severe cases, we can also use an immunomodulatory drug like cyclosporine. Ocular allergy needs to be controlled very well because it can carry some dreaded complications in future life. Like it can cause bulging in some portions of cornea which is called keratoconus. Keratoconus can be proved very detrimental in terms of visual quality. In chronic ocular allergy, corneal vascularization can develop and even seal ulcer can develop. So, we need to take care of ocular allergy very well. We need to take some specific remedies so that we can combat ocular allergy. We have to make the habit of wearing glasses whenever we go outside. We should keep in mind that we never should rub our eyes vigorously because this can lead to refractive errors. This is all about ocular allergy in nutshell. Thanks for listening.